Member Nanaimo, North Cowichan.
Thank you, Mr. Speaker. It always gives me pleasure to stand up in the House and speak about the principles that I've tried to represent in asking people to elect me as a new Democrat MLA, to see those principles materialized in the lives of British Columbians. And that's what I want to talk about today. I want to talk about the investment in public health care and why that is so important in our culture, in our society, and in this House. The Premier recently said, by improving how we connect people to care, we can help make sure that British Columbians get the health care they need faster and closer to home. He said the kind of care people need and how it's delivered has to change. It's no longer as simple as a doctor-patient relationship. We need to be looking forward and providing team-based care that better meets the needs of British Columbians. In every community I visit, the Premier said, patients, doctors, nurses, and other healthcare professionals all say the same thing. Healthcare delivery must become more patient-centered, and we're getting the job done. So the Premier was talking about something very far-reaching. That was a big statement. And the immediate question that comes to people's minds is how do you materialize that? And the government is focusing on 3 areas in trying to deliver on that principle and that goal. The first challenge the province has addressed is the shortage of general practitioners, family doctors. And we are doing that, Madam Speaker, by providing funding for up to 200 new general practitioners to work in the team-based care model in urgent primary care centres. We're offering opportunities for every family medicine resident to work in a renewed primary care system. Essentially, 3 steps are being taken. Primary care networks are being established, and these networks will be the backbone to the team-based approach. This will allow patients access to a full range of healthcare options from maternity to end of life, streamlining referrals from one provider to another, and providing better support to family physicians, nurse practitioners, and other primary health providers. These networks will be rolled out in at least 15 communities and I believe 10 have already been established, along with 10 urgent primary care centres. These centres, the second step, will be new to BC and will provide primary care to patients who currently do not have a family doctor or nurse practitioner, and weekend and after-hours care. This will take great pressure off hospital emergency departments. A total of 10 centres will be established, as I said. Most of those are already up and running. There are 3, I think, that are partially established, as well as 7 that are fully operational. Then the third step will be community health centres, and these health centres will bring together health and broader social services to improve access to health promotion, preventative care, and ongoing services. Each of those centres will be designed and developed uniquely in line with the needs of their communities and fully integrated into local primary care networks. These are really important steps, Madam Speaker, and I think you can see that there's a theme running through that, and that is innovation. Trying to take the challenge that we face in a shortage of family doctors and turn that into an advantage somehow, in that how we address it actually improves the care that people receive. Not only are they able to go to a predictable place with predictable people to get care, but there's a network that surrounds the patient, and the patient becomes the center of that focus. Madam Speaker, the urgent primary care centres do provide extended hours and basic in-office urgent care services, things like sprains and simple fractures, minor cuts requiring stitches, burns, minor burns, and rapid access to mental health and substance use crisis intervention services. And I think that's a very important aspect of this, that as we face a society that's so challenged by issues of mental health and by issues of addiction, we have to find ways to support people in a more holistic way. And when we look at all of these services and ask ourselves, what is the purpose of such a large investment and such a innovative approach to a problem. And the reason people are motivated to do this is, yes, to keep people healthy, and yes, to not incur cost. But in a broader picture, Madam Speaker, a healthier society is healthy for everyone. If there are fewer homeless people, there are fewer people who are sick, even those who are wealthy and healthy will live in a better community. So in order for people to thrive in this province, they need to have support. And I'm proud that our government is providing that support in terms of their health care needs by taking what is a really difficult challenge, managing a shortage of service, and actually addressing it in a way that will ramp up the quality and the level of service. So we're very proud to represent that here today. Thank you.